We have continuing coverage as newly released reports from the Centers for Medicare and Medicaid Services show more of what it was like inside Cottage Hospital in the months leading up to its closure. It's a story we've been covering for weeks, so here's some of the background. Back in the summer of 2020, Galesburg-Cottage-Hospital is sold and bought by the Sharma family, led by Dr. Sanjay Sharma. Then the hospital was investigated by CMS late last year. Early reports from that investigation showed an overwhelmed and understaffed nursing team, and that all brings us to January 8th, when the hospital unexpectedly closes. Dr. Sharma has said it will reopen, but nearly 5 weeks later, there is no sign that the hospital can operate ever again. Tonight, News 8's Shelby Kluver breaks down some of the new findings in that CMS investigation.
Today, Galesburg Cottage Hospital stands empty. An investigation in the 2 months before it closed found an array of health violations at the facility owned by the Sharma family. The newly released documents from the Centers for Medicare and Medicaid Services report the hospital failed to keep its building up to code, its staff certified, and its patients safe. That report was triggered by complaints, leading to 4 in-person visits. In December, expired medication, including a bottle of lidocaine and 9 vials of Definity, were found available for patient use. Hazardous oil was discovered in a cabinet, and there were flammable oxygen cylinders and nitrous oxide tanks just sitting in rooms instead of secured to a wall. At the same time, new and remaining nurses were being pulled out of training to help with staffing shortages after dozens of employees were terminated. Investigators also found a lack of certification for many employees, including one nurse who was administering blood without the required credentials, and a pharmacist that was working without the necessary competency records. According to CMS, Cottage's HR was aware of these issues. Plus, there were major red flags about patient rights. Certain psychiatric patients required checkups every 15 minutes, but reports show there were days where these were missed, including one patient with dementia who went over an hour without a checkup. In October, one patient was held down in 4-point leather restraints without being checked up on for over an hour. In fact, 4 out of 5 personnel files were missing proof of the required restraint training. While the Sharmas have said they're appealing CMS and plan to reopen soon, a CMS spokesperson confirmed there has been no such attempt by the Sharmas so far. Shelby Kluver, WQAD News 8.
The government also says there were months of missing documents, including those related to the hospital's weekly generator testing and required fire drills. Cottage's owners, the Sharmas, did not respond to multiple requests for comment.